Hello, in this video I'll be talking about the role of antihistamines in controlling pain related to breast cancer and its treatment. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized report. That way you can find out if any of these treatments that I talk about today might be part of your treatment plan. So antihistamines in treating breast cancer pain. There are a couple sources of pain from anti-cancer treatment in people with breast cancer. I'm going to start with the first one in terms of a treatment course, and that is with chemotherapy. Some people get growth factor shots to keep their white cell counts up so that they don't become at risk for infections, and also these shots can keep you on schedule with your chemotherapy. So growth factor shots, and you can check out our video on growth factor, can sometimes cause pain inside the bone from the bone marrow expanding. So with growth factor shots, we want to keep your white cell counts up, and if your bone marrow is really enthusiastic in how it can respond, that can actually lead to bone pain. And an antihistamine, Loratadine, the brand name of which is Claritin, has been seen to help with that bone pain. This is not one of the indications or what we say on-label uses of Loratadine, but we can tell you anecdotes and some small studies have shown that it's very useful. So with pain related to growth factor injections, Loratadine can be helpful. Then at the other end of your treatment, after chemotherapy, if you are receiving an aromatase inhibitor, and you will want to check out our video on aromatase inhibitor, aromatase inhibitors can sometimes cause joint aches and pains, and this is actually the most common symptom from the aromatase inhibitors, and we do see it in people on tamoxifen as well. But the same medication I just talked about, Loratadine, brand name Claritin, which is a prescription medicine or over-the-counter, has been shown to help with aromatase inhibitor pains in a couple of small studies. We'll put a link to one of those studies in this video. So if this is something you're experiencing, joint aches and pains, it would be reasonable to ask your medical team about whether or not you can try this medication. It does not appear that Loratadine interferes with endocrine therapy for the treatment of breast cancer, and so it may be worth a shot. Again, I have to say this is off-label use. This is not something that is in the package insert that it's approved for by the Food and Drug Administration. But to be honest, a lot of things that we use for symptom management are also not FDA approved for that indication. They're FDA approved for something else. We just want to be careful that Yerbba doesn't come across as recommending something off-label. But again, there's enough evidence that this is something worth talking about with your medical team. These are oral medications. They're not inhaled, the Loratadine class of medication, and it seems to be that this is the one drug that's been studied the most and found to be useful. This is interesting. We don't actually know how it works. The way these medicines work is through blocking histamine and from getting elsewhere in the body, and it's possible that histamine mediates pain, just like it mediates allergy symptoms. So by blocking histamine, that may be how the pain is being treated. Just because we don't know how something works doesn't mean it doesn't work. We always like to know, how does it work? Is it plausible? Does it make sense? And is there a dose-response relationship, so more of it helps pain more? But regardless of our not knowing the mechanism, if you are having pain and thinking of coming off medication, if you are suffering, certainly doing anything you can to help would be reasonable. So talk with your medical team, see if this might be an option for you. Drop a comment or a question below. In fact, this video came about because somebody was commenting about aches and pains, and let us know if it's worked for you. As always, thank you for watching.